Hi, this is Gina, and I've got Celine here with me today. We're here for our acne live chat. And before Celine gets started, I wanted to pop in and just give some announcements for you guys. Today we are going to
wait a little bit. People are slowly ticking in here. Let's wait for
give
people to join
time.
us here.
Okay. I'm just ready to hop right in there. Get so excited to talk about acne.
It's been really fun getting used to doing all these lives with you guys, because we're kind of learning as we go, kind of learning to let you guys kind of trickle in and answer the questions that come in. It's been really fun for me.
Yeah, really fun. So we're up to 11. Can I start now?
Okay, go ahead.
All right, today we are going to be talking about Acne Med, how to use it, when not to use it, what to use with it, and what not to use with it. And really, we're going to give you a deep idea of, or a quick idea of how Acne Med really works so that you can optimize your skincare routine. We're also going to talk about some skincare gels that are safe to use with Acne Med, depending on what your skin type is and what your concerns are. But before we go there, I wanted to give some quick announcements. I want you guys to know that Face Reality goes up in price on April 1st. And every item is going to be $1, $2, or even $3 more than it is now. So today and tomorrow are good days. If you can, stock up on your Face Reality supplies so that you can save yourself a little bit of money. The next thing I want to talk about is that we will be doing some shows, and we're really going to dive deep into, what do you do weeks 1 and 2 of a Face Reality routine? What do you do weeks 3 and 4, and then 5 and 6 of a routine? We've already typed up those protocols, and you can see in the very first comment there, I have a link to our blog. So you can go ahead and click on that link. This video will follow you there, and you will see the Face Reality protocols. And I want to point those out to you because some of you haven't started Face Reality yet. And if you want to know where to get started, you want to start with weeks 1 and 2. If you're already on a Face Reality protocol, but you're not getting clear yet, you're going to want to look at those different weeks and kind of see where are you at in that progression, and then you'll know what you need to do to bump. So what happens with the skin and with acne is the skin acclimates. It gets used to what you're using, and it just keeps breaking out. So with acne, we have to keep pushing the skin, usually every 2 to 3 weeks. We push the skin until you are staying clear. So that's why we have those different weeks of the acne routine. But I want to give you guys a caution and some education on that, is that you need to know when to push and when to hold. So in your routine, if you've just completed 2 weeks, say you're on weeks 1 and 2, and you've just finished those 2 weeks and you're still breaking out, and you're not really very dry, you're maybe just a little bit dry, but not super dry, then it's time to push. And then you'll move on to weeks 3 and 4. If at the end of weeks 1 and 2, you are very dry and you're even a little bit flaky and peely, hold. That means you need to stay with where you're at until that peeliness subsides. When that subsides, and if you're still breaking out, then you would bump up to weeks 3 and 4 or 5 and 6 as you go along. So I wanted to give you that link today so you can go ahead and get yourself started, or maybe see where you need to be bumping your skin, or maybe seeing that maybe you bumped too fast and you need to stick with the previous 2 weeks a little bit longer. If you have any doubts or questions, you're wondering what to do, head over to our Reward Center. Well, first of all, log in, sign in, then go to our Reward Center and look for the skincare checkup form. We call those CHUPs. So fill out your CHUP, and an acne specialist here at Art of Skincare can look it over and tell you what your next bump should be. Or if you're just forever peeling and it's not subsiding after several weeks, then we can also give you some insights into what you can do to buffer what you're doing so that your skin is not pushed quite so hard. We do want your skin to be dry. Skin that is a little bit dry and even a little bit flaky at times will heal faster, but we don't want you so dry and so peeling that your skin's getting red and irritated and you're developing sensitivities. So if you are in question, not sure what to do, go ahead over there and do a skincare checkup or reach out to your acne specialist. If you're in our acne coaching program, reach out to us and your acne specialist will help you determine what the next best step is for you. So without further ado, I would like to introduce Celine. And she's going to talk to you today about Acne Med and some alternatives to Hydrobalance that you might like to learn about. And I'm going to take over the chats and the questions over here. So you guys just send your questions at us. Some of them we'll read out loud. Some of them I'll just jot answers to you right here as we're going. So there we go. All right, Celine,
all right,
you're on.
Let's jump in. Okay. So I'm going to go into serums and hydrators that you can use underneath your Acne Med. So, as many of you know, you do not want to be using thicker creams and lotions over your Acne Med or underneath your Acne Med because Acne Med uses oxygen to kill the P. acne bacteria that's in your pores. So it has to utilize oxygen, therefore you don't want anything occlusive underneath or over the top. You want lightweight gels that can nourish your skin and help kind of slightly buffer that Acne Med while still letting the Acne Med do its job. So, without further ado, let's jump into our #1 selling hydrating gel. Many of you have probably used this gel.
Can we give them a little more tips on Acne Med?
Oh yeah, let's jump back in.
Right, so just because I know some of you moms out there, when your kid gets on Acne Med, you can get really irritated if you have beautiful designer towels in different colors or really nice sheets. And what you need to know about Acne Med is that it bleaches everything. So give your kids either old towels and sheets or use just white sheets, white towels. If you have acne on your body and you're using Acne Med at night, wear an old t-shirt to bed because that old t-shirt will protect your bedding and stuff like that because Acne Med definitely bleaches and eats holes right through things. It's kind of funny that way. Okay, the other things about Acne Med, we want to avoid the eye area, so keep your Acne Med away from there. Do not get it in this nasal labial fold. If you have breakouts in this area, just kind of spot treat, but be careful because this area can get very dry and sensitized, and often you'll have to avoid the neck as well. Acne Med can be a little harsh on the neck. If you're getting a lot of breakouts on the neck, we'll have you use Acne Med there, but we'll put a pretty strong buffer underneath to help keep that skin from getting really dry. Is there any other tips? Acne Med tips?
It will also bleach your eyebrows.
Oh yeah.
So definitely, you're wanting to avoid the eye area anyways, but if you have a teen or someone who's used to they take their lotion, they just mush it all over their face, make sure they're gently applying around the eyebrows, not getting it in their eyebrows, or they will have lightly tinted eyebrows from their Acne Med or their Benzoyl Peroxide.
But your skin will be clear.
Yeah.
You might have white eyebrows, but your skin will be clear. So,
yeah.
But yeah, kind of avoid that area. If you're getting breakouts in those brows, because we do get those, be sure that you're using your toner in that area and you're using your cleanser and your mandelic serums go right into the brow area. If you find you're really still getting a lot of breakouts there, then that's when we'll pull in the Face Reality Sulfur Spot Treatment. Sulfur Spot Treatment will not bleach that area and you can put that on that area without bleaching the hair. Really good points there. Okay, so I think we hit everything. You already hit on no oils or lotions or creams because it'll travel through there and it'll turn off your Acne Med.
Yep.
You got that. And so now I'll let you dive into the fun stuff. Okay.
So no heavy creams, lotions, anything that's thick or has creaminess to it. So instead we're going to choose hydrating gels. And we're going to start with our most popular one. Many of you have used this gel if you've used Face Reality. This is Hydrobalance. Hydrobalance is amazing for normal to oily skin types. It's really great for teens, anyone who doesn't need a ton of hydration in their hydrating gel. They just need something to get that hydration on their skin. It does have kind of a lilac floral scent because it has lilac stem cells in it, which are a really powerful antioxidant. But you can smell them in the formula. It's kind of interesting. It also kind of has like a greenish, brownish color also from those lilac stem cells. It's the totally natural color of this product. Sometimes it's more blue, sometimes it's more green, sometimes it's more yellow. It just depends on the season. Because they are harvesting these plants seasonally. So all plants, they kind of differ in potency and in the smell or in the color.
And that's nice to know that you're getting a product that's pretty natural. With HydraBalance, it's important to know that HydraBalance goes underneath your Acne Med, because people often think they want to put Acne Med on and then put moisturizers and things on to finish a skincare routine, but not so with a Face Reality acne routine. You're going to put on HydraBalance first and then your Acne Med on top. Now, if you want to use HydraBalance during the day, you would put your HydraBalance after your Mandelic Serum, unless you're very dry. Then you could do what we lovingly call
sandwich.
a HydraBalance sandwich. So put on your HydraBalance gel, put on your Mandelic Serum, let it dry, then put on another layer of HydraBalance gel, and then you can put on your Cran Peptide or your Clear Derma and your sunscreen. Or if you have a little oilier skin type, you can skip Clear Derma and Cran Peptide and just put on your sunscreen. Clear choice, right?
Okay. Yes, so rule of thumb, Acne Med goes last. Because anything that you're putting on top of Acne Med, it's just going to be pushing it around, pushing it to the sensitive areas like around your eyes, into your nasolabial folds. You just want it to be the last thing after your hydrating gel at night.
Yes.
Okay, our next...
And you don't use it during the day. I have clients that get confused about that. They're using it morning and night. It's a nighttime thing. If you need a spot treatment during the day, that's when you pull out the sulfur spot treatment. Okay.
Okay, the next one we're going to go into is if you have more dry skin. So this is Michelle Corley's Ultimate Hydration Gel, and I love this gel. There's no scent to it, so if you're sensitive to the scent of HydraBalance, you'll prefer this one. It's definitely a little more hydrating, a little bit thicker than HydraBalance. It also has licorice root, which is very calming, and it actually helps prevent PIH mildly. It's definitely for anyone who has maybe more sensitive skin, more dry skin, and wants extra hydration. Gina even uses this. This is like her favorite plumping product. It is very, very plumping, especially with the wave.
I didn't use it for a good year after it came out because I thought, oh, this is for my acne clients. And one day I put it on and I went, oh, this is for me too.
I think I turned her onto it because I've been using it since it was in a jar. It used to be in a jar rather than a pump. It is my go-to summertime hydration gel because it is so lovely.
Really nice and no scent at all and no pilling. Goes on beautifully.
Okay, next up is for our sensitive and redness prone folks or very reactive skin. Usually we wouldn't really put you on Acne Med if you have rosacea. It really depends on your skin, so don't jump on the Acne Med if you have rosacea.
Unless your acne specialist
Unless you're working with
tells
us.
you to.
Yes. Yeah. But for that sensitive, reactive skin, and even a little bit drier side, Hush Hydrate Gel. This is probably the thickest gel that we have in our lineup. But it is a beautiful blue color. It is packed with antioxidants and anti-inflammatory ingredients. So if your skin is very inflamed and sensitive to the touch, this is going to be amazing for you. You can actually also use it kind of like a hydrating mask at night. You could put a really thick layer on, let it sit for 10 minutes, wipe away the excess, and then apply your Acne Med on top.
Yes, it's lovely. And Morgan, our acne specialist, she loves this, uses it with a lot of her clients that are prone to redness. Need that extra anti-inflammatory help.
I love it too. That is another go-to for me because I am more prone to redness as well. Yep. Okay, the last category is my favorite category because it's full of our heavy hitters, our like holy grail gels. These are the best of the best. This is if you're really looking to upgrade your Face Reality routine, you want to add things for PIH, which is post-inflammatory hyperpigmentation. That is the red marks that are left after acne, after you have an acne breakout that feel like they're just never going to go away. They've been red for a couple weeks, you're feeling frustrated. This is when you can add in these heavy hitters. So it is a trio of products. And let's start with what goes underneath your acne med. So you have two options. We have Neogenesis Skin Serum, and we have the Rhonda Allison Vital Repair Gel. So these are both growth factor serums, but I will say that Skin Serum is like Vital Repair Gel on steroids. It is definitely,
this is the stronger.
It is stronger, but it is a bit more costly. So it doesn't fit in everyone's budget, and that's okay. You can still get amazing results with Vital Repair Gel. It's just going to be maybe just a little bit slower. Whereas Skin Serum, it's like after 5 days of use, you're like, holy moly, this is crazy. Whereas Vital Repair Gel might take a little bit longer to see those like, oh wow results, but you're still going to get them.
Still get great results.
It's really amazing.
I often use Vital Repair Gel with teens, younger people, because they have more growth hormone going on. Their skin heals faster. So this is still going to help their skin to have that healing support without scarring and faster healing, but they often don't need the big guns of the skin serum. So either one of these, you know, acne is notoriously slow to heal. And a lot of people find, especially in their later 20s and 30s, that their skin is just healing so slowly, and that really contributes to the scarring. So by using these as your hydrating gel, you can use them morning and night. They're going to really speed up the healing and reduce some of that scarring.
I also feel that this one here, Vital Repair Gel, this one is also a little bit better for just reducing general redness. This has licorice root in it.
Yes.
And so it also helps just reduce redness immediately and overnight, as well as giving you those growth factors that are going to speed up healing over the long term.
Absolutely. And for those of you who are already got some PIH, which we call post-inflammatory hyperpigmentation, that's where you get that dark red spot after a blemish. And what happens is that red spot means there's still blood flow going to that area. It means your body is still trying to heal those underlying tissues. So having one of those healing serums really helps. And it's also important to give the skin some extra support. If you, first of all, know that it takes 6 to 9 months for that spot to fully heal. We can help that along with the skin healing serums, but you've got to be patient with it and treat that area very gently, because if you use harsh tretinoins on there or harsh things like you're trying to bleach that skin out of there, you're going to damage that skin more, and then you're going to have dark brown spots there. So you're going to have that PIH turning brown and having a brown spot. So what we recommend for our clients is to use
Lemon Lightning Serum.
Sorella Lemon Lightning Serum. You can layer that over one of these. We even have clients that are able to use Lemon Lightning underneath their acne med without having any problems. Sometimes we won't do that till you're mostly clear, or if we need to do it sooner, we'll put you on a little stronger acne med to go with it. But Lemon Lightning Serum is a really good friend of people who have acne and who just get dark spots so easily from their breakouts. You could use these two. You could use one of the repair gels, the growth factor gels, underneath of this one. So in the morning, you'd put on your Mandelic Serum, then put on your wound healing serum, and then put on your Lemon Lightning. This feels like a little light cream, so some people who aren't very dry could use this as their moisturizer. Lemon Lightning might be your moisturizer, and then you just put sunscreen on top of it. If you have drier skin, you're going to want to put probably cran peptide on top of it and then put on your sunscreen. But Clear Choice sunscreen actually has,
it's very moisturizing,
a lot of moisture, so you could definitely give it a try and see if Lemon Lightning will be enough moisture for you as your daytime moisturizer. And then use your Vital Repair wound gel or skin serum under your acne med at night. So, but if you could only have one thing and you really want to go after those dark spots, we have clients that do this. They put this one, they just get this one and they put it underneath their acne med at night and still have good results. So, yeah. So we have some questions. Yay! Let's open up to questions. There are a lot of gels on our website. Any gel that you see that intrigues you, that you want to try, as long as it has a gray acne safe badge on it, it is okay for you to use. And if ever you're in doubt, just reach out to our live chat. We have estheticians and acne specialists right there that can answer questions and help you find just the right hydrating gel for you. There's hydrating gels that are like pure hyaluronic acid. Those can be great in a dry environment. If you're in a really humid environment, you don't really want hyaluronic acid, you want one of the other kind of hydrating gels. Some people like to have some vitamin C in their hydrating gels, and we have some of those that we can share with you. But I'm going to jump over here and read questions for Celine. Christina wants to know, Celine, can you use NG Recovery under Acne Med?
Yes.
Absolutely.
Yep, 100%.
It'll definitely help speed the healing, probably the most of anything we've said here. But what you have to know is Recovery does not have any hydrators in it. So you're gonna still need to use one of the hydrating things. I mean, maybe you would use Lemon Lightning and then put on your Acne Med, or maybe you'd use Hush Hydrate, or maybe you would use Michelle Corley's Ultimate Hydration. You'd still want something like that underneath your Acne Med. Now, this brings to my mind, I have a client I worked with yesterday, Hendrik, and he has been using Acne Med at night, and he's been putting Hydrobalance underneath it, but he's more prone to combo oilier skin or normalish skin, and we need to push his skin a little bit, and so I want it to be a little drier. So always go, well, let me back up. I want him to be a little bit drier, so I told him no more Hydrobalance at nighttime. I just want you to use your mandelic acid, let it dry, and then put your Acne Med right on there, and then nothing else, because I want him to be a little dry. So always, take what we have to say, but really follow the instructions of your acne specialist, because we know more about what's going on with your skin. We have had our eyes on pictures of your skin, and that really helps us to give you more personalized advice. So take what we say here as a grain of salt. If you're working with an acne specialist, do what they say. If you have a question or you think you want to try something we mentioned, go to your acne specialist and ask them if that would be the right choice for you and what to do. Okay. Ari says, can I use the SkinScript Light Aloe Moisturizer as a sandwich method with my mandelic acid or under Acne Med?
Yes.
100%. And if you know, that comes in a big pro size. You can get
huge.
a big bottle with a pump of that. So if you've got a couple kids on a face reality protocol, that big bottle of that could be very helpful for you. Okay, and let's see. Christina says, during the day, should mandelic go in before recovery serum or the other way around? Recovery first. Always recovery first. Megan, I can't seem to get up to the 5% Acne Med. Okay, so it sounds like if you're wanting to push up to 5% acne...
She gave us some more information.
Oh, she did, okay. Each time I try, my skin freaks out, very red, irritated, working with Morgan, not sure what happened because I used to use 5% years before. So what I want to make sure, Megan, is that if you're making that jump, don't use mandelic acid at night, right? So if you're now on Acne Med 2.5 and you've been using mandelic acid underneath it, take the mandelic out while you're getting used to the 5%, number one. Number two, alternate. So one day it's 2.5, the next day is 5, then 2.5. Just keep alternating till the skin adjusts. And then, of course, you're going to want to choose probably Ultimate Hydration Gel to put underneath your Acne Med and let it dry. Let this dry and then put your Acne Med on. So if you've already done all those things, comment in here and we'll brainstorm some more. But that's where I would start with you, and probably Morgan is already doing that. Okay, let's see. Caitlin says, love and only use Face Reality products. Not question related to Acne Med, but do you have any product recommendations to give yourself at an at-home facial? Yeah, so remember in the beginning, I talked about when to know when to push your skin and when to hold. So if you're an acne-prone skin type and you're in a pushing phase and your skin is getting dry and flaky, that's the perfect time to add an enzyme into your routine.
I actually have a video that'll be posted probably a week or two that's all about doing this, but we can touch on it here.
Yeah, let's touch on it because it's going to be posted really soon. But you can use an enzyme to digest away all those dead skin cells and then put on a hydrating mask like Hydrocalm on afterwards to rehydrate the skin. So that's an excellent treatment that you can do at home. And then if your skin is just still breaking out and you're more oily and you need to push your skin, that's when you can do more of a peel type of treatment. And that's when you can grab Lilexos or Mandelic
MA32 pads.
MA32 pads, and you can use those 2 or 3 pads. Use one, rub it until it dries, wait a few minutes, maybe 5 minutes, then do another pad. If it still feels fine, do one more. I like to do 3 pads. And then you can top that with either our TCA cream that we have, or if you're on vitamin A corrective, you could top that with the vitamin A corrective. And that will be an excellent peel that you can do for yourself at home.
Only if you're not dry and peely.
That's right. We never, even in the treatment room, we never do a peel on somebody who is already dry or peely. That's when we pull out those enzymes and we do an enzyme treatment. Which enzyme did you talk about in your video?
Neogenesis Cream Enzyme Mask.
Yes, that one's excellent. And it's very, very similar to the one that Face Reality sells for back bar use, for professional use only. I maybe even like it a little bit more. So I think you guys would really like that. If you have very, very sensitive skin, then you could go with Botania's essential enzymes. And you can use those even a little bit more often, and they will also help with just digest away, enzymes digest away those dead skin cells. Just drop my glasses. Okay, Caitlin says, do you also have any recommendations for spot treatments?
Yeah, we have a couple different options. So my personal favorite is sulfur spot treatment. I feel like every time I use sulfur spot treatment, I see a huge difference the next day. So that's one amazing product.
Yeah, and
that really calms inflammation in the skin and is really good for those angry, inflamed breakouts.
Absolutely, and it's made by Face Reality, in case you don't know what we're talking about. And it's also, I use it a lot with really oily skin. So during the day, if you are one of those people that by midday you're an oil slick, you might like just putting on a thin coat of that sulfur spot treatment on your oily zones, because sulfur is very good at absorbing that excess oil. Another spot treatment?
I was thinking about...
Go ahead.
Go ahead.
No. Oh, okay. Maybe we're thinking the same one.
Maybe.
The Bion Green Tea Clay Poultice is a wonderful kind of clay spot treatment. You do not use it on blackheads because it will just dry up those little blackheads till they're stuck in the skin. But if you have an inflamed pimple, Green Tea Clay Poultice is amazing.
I also wanted to point out, we have Clean Skin Club came out with new pimple patches, and they're like the best ever. I've tried a ton of different pimple patches. We tried selling a different brand for a little while, but we didn't love them. So we do have pimple patches on our website now that are really wonderful. That's a great option if you need to go to work or go about your day and you've got an angry, sensitive pimple that needs protection and healing. It really helps those spots. It also keeps you from picking and touching at it as well. So I highly recommend pimple patches.
And
Good stuff.
remembering though, at nighttime, Acne Med needs oxygen to kill the P. acne. So don't be putting that on top of your Acne Med. If you want to spot treat something on top of your Acne Med, that's when you want to use sulfur spot treatment.
But also remember that while Acne Med can help pimples that are already in their open inflamed state, Acne Med is really for prevention. It's going into the pore and taking care of those P. acnes before they start to proliferate and turn into those big angry pimples. So using sulfur spot treatment or another spot treatment like the pimple patches is actually better if you already have a pimple that's come to a head and it's really just needing to calm down and heal. That's when you want to reach for pimple patches, sulfur spots, EGF. The EGF products we've talked about, like skin serum,
those help with spots.
These help with those spots, help them heal and go down.
One of our clients who's a grandma, she puts her Neogenesis eye serum on her grandchild's blemish and it goes away. So it's pretty cool.
That.
This, I'm so glad you brought that up, because what I really want to say is that sometimes when especially kids, when their skin's pretty clear, they stop doing their nighttime routine, or they stop using their acne med. And when you do that, you're just going to have breakouts coming in the next few days or the next week, because the reason, as Celine said, the reason we're using acne med is actually prevention. It does help with established blemishes because it's going to, of course, kill the bacteria there and also dry them up. But our ultimate goal is to prevent more breakouts, and acne med is essential for that. Really need to stress that. Okay, Megan says, Morgan does have me on Mandelic 5% AM and PM. Was just using a Hydra Balance at night. I used to use the 8% with zero issues, so I know the 5% is gentler than the 8. Yes, and she says, I don't have a face reality specialist near me. Would it be a bad idea to get SkinCeuticals peel? Could that cause more breakouts? So
yeah,
I
here. Can I check?
Oh yeah,
okay.
Go ahead.
So if your skin is intolerant of something like Acne Med 5%, which we kind of consider more on the milder side, or if it can't even tolerate an 8% Mandelic, getting a peel is not the choice. It sounds like your skin is actually having some barrier issues, especially if you were able to tolerate some of these products in the past and now it just reacts and reacts. It sounds like you might have some skin barrier problems that you need to focus on first before you go into anything more corrective. So at this point, I would say get some more hydration in your morning routine. Leave off that Mandelic at night so that you can use the Acne Med without any problems.
And this is what you want to put under your Acne Med, and even during the day, as well as a heavier moisturizer during the day. We've got to do a lot of repair of your barrier so that, and in fact, when your barrier is pissed off, you're going to break out more. It's like the skin just gets pissed off and breaks out more. So if your barrier is very disrupted and it's really reactive, that's a sign that your barrier is disrupted. Then you need, as Celine said, a lot more hydration, better moisturizer, better sunscreen, and then using the heaviest you can get of our gels, which is the Michelle Corley Ultimate Hydration Gel. That needs to go underneath your Acne Med, and then alternate your Acne Med. Now, occasionally, I have a client who gets to, their barrier is compromised. They can't use their Acne Med, and what we do with them is we have them pick up the Acne Wash, because that is a benzoyl peroxide wash. So at nighttime, you would use that Acne Wash to wash your face, and that will begin to help strengthen your skin. So if we have a client that can't even use 2.5, we have them use the Acne Wash at night, and then use, their Mandelic serum and their moisturizer, their full-on regular cran peptide moisturizer. Use that at nighttime, and the BPO is going to be in the form of that Acne Wash. So there's a number of different ways we can work with that. I can chat with Morgan afterwards, and we can go over your file for you and see what ideas we come up with, which would be best for you. Maybe the best thing would be to switch now to Acne Wash, but maybe it's just that we need to add in some more heavy-duty hydrators for you, and definitely doing that alternating 2.55, 2.55, and then no mandelic acid at night. And don't even entertain those thoughts in your head that, well, I used to be able to use 8, why can't I use 8? Or I used to be able to use 5. Don't even think about that right now, because we just want to address your skin where it's at right now. And if you're still getting breakouts right now and you need to bump, you're getting breakouts, then we need to bump your strength of your Acne Med, then we'll play with it and we'll do some of the things that I mentioned. But Morgan and I'll chat on it, and then we'll reach out to you, and we'll get you on the right track. No problem there. And also, yeah, that's it. There's so many ideas that go through our heads. Okay. Christina, the skin around my eyes is extremely sensitive. Best eye products to use at night with Acne Med.
Ooh, okay. So I do recommend going back, watching my live from last week, because we talked about all the eye gels that you can use with Acne Med. But I think the thickest one, I feel like it's the Sorella Aloe Cucumber Eye Gel. That one is very thick. That will really protect your eye area from the Acne Med. I also, if your eyes are really, really sensitive and they really need some buffering from Acne Med, I would say use something a little bit creamier, like the Youthful Eyes Peptide Cream from Bion Research. And then just apply that just in the eye area before you do your Acne Med. And to me, I don't feel that it matters if it's going to turn off the Acne Med, because it's only around your eyes anyways.
Don't do that. Don't do that. No. Sorry. Sorry. I have to disagree with that.
Why?
Because it travels. The Acne Med will travel through the youthful eye, and it will irritate your eye area. So here's a couple things for you to do. One is look for your eye gel to have, very simple ingredients. So Neogenesis eye serum would be very good for you. Let it dry. Put on your Acne Med, and then what you want to do is you want to protect that area. So you want to go on our website and go to Rhonda Allison Pro Salve. And you're going to put a little bit of Pro Salve, even before you put on your Acne Med, put a little bit of Pro Salve on that orbital bone, and that's going to stop your Acne Med from traveling into the eye area.
Because Youthful Eyes dries down. It doesn't stay creamy.
I know it doesn't, but we will still have problems. So if you really wanted to do that, I would say the only way to do it is to put Pro Salve on afterwards to keep the Acne Med from traveling through there. Just because I know I've worked with so many people with really sensitive eyes like you, where some people, their eyes are just not that sensitive and they can use pretty much anything. But I know for you guys who are really sensitive, you want to go with the simplest ingredients. So Neogenesis eye serum, and if that's out of your price range, then Michelle Corley's Revitalizing Peptide Stem Cell Eye Serum is the longest name ever. You could put that one on, let it dry, then put on your Pro Salve, which is an occlusive, just on that area and maybe on your lips. It's really nice on the lips. And then put on your Acne Med, so it just can't travel through there. The other thing is the pillowcase trick. Because at nighttime, if you're using the same pillowcase every night, your Acne Med rubs onto your pillowcase, and then it can get into your eye area when you're sleeping. So what we do is the pillowcase trick. You put your pillow in the pillowcase, and on night one you use side A, and then the next night you flip it over and use side B, and then the next night you take off your pillowcase, put it on inside out, and use one side, and then the next night the other side, and then you peel it off and you wash it. So you're washing your pillowcase every 4 uses, and that helps to keep that traveling and stuff from happening into the eye area. Okay. Yes, and Christina says the Face Reality Eye Gel irritates her eyes. We do find that it's very common. We find that most younger people, or those like we talked about with the tougher skin, they have no problem with it. But we do have a lot of people with more sensitive skin have to avoid that particular eye product. Megan says, are extractions necessary? Professional ones to get clear. I have tons of closed comedones, just keep erupting. So I'll talk to Morgan about your case. So closed comedones, I'm taking that to mean you have pebbles under your skin, so you have maturation arrest. If you have maturation arrest, then we could even, there's 2 kinds of maturation arrest, so let's get really technical here. Maturation arrest is when you pull the skin taut and you see little bumps underneath the skin, little what we call pebbles. Those are blemishes that are arrested. They're underneath the skin and they're just not doing anything. Now there's 2 types. In my practice, I've determined there's 2 types of maturation arrest. There's those that are non-inflammatory. That means that when we do bring those to the surface, they just open up and they turn into a blackhead and they extract out. Then there's the other people who have inflammatory maturation arrest. So as they come to the surface, they erupt into pimples. So people who have maturation arrest that are inflammatory need acne med. Those who do not, that just open up into blackheads or squiggly stuff that comes out, those people don't need acne med. They need vitamin A corrective. So we really, I need to do some digging in, Megan, for you with Morgan, and really looking at, I need to see pictures of you and stuff to give you a more definite idea of what you need to do. But Morgan and I will do that. And if you could chat in, Megan, because right now I just have your first name. Chat into live chat with your full name and just say, hey, I would like Gina and Morgan to look over my chart. Then we can do that together and we'll know who you are in there. Okay, Christina. She says, I'm mostly clear these days, but sometimes get tiny little white heads near my mouth. They pop with almost no pressure, often with washing. What's best to prevent? So what I want to make sure for you is that you don't have perioral dermatitis. So make sure that you're using a toothpaste that's free of sulfates and that it does not have fluoride in it, because those are two things that can really aggravate that area. Be careful if you drink a lot of citrus or acidic things. That can really aggravate that area. Probably avoid your acne med or your acids in that area and use more hydrating things like your Hydra Balance or your hydrating gels, and don't over moisturize that area with heavy moisturizers, because perioral dermatitis doesn't like a heavy moisturizer. But try those things, see if it works. Sometimes those little pimples like that can be alpha hydroxy acids. So if you're using glycolic acid in something, that might not be a good idea for you. All right. Caitlin, can your skin become used to acne med where with continued use it will not be as effective? Adding acne med has made my skin finally remain consistently clear. Can your skin...
I think if you've gotten clear on the acne med that you're on, then, you can jump in. But in my experience, I feel that most people can stay on that level. It's working for them. Their skin's, most of the time, the skin doesn't adjust after that point. When we are bumping up actively, that's when the skin isn't getting clear with the level of acne med that it's currently on. So if that level that you're on right now has gotten you clear, then you can stay there on that level. You don't have to keep bumping it up.
Yes, and we often have people stay there a year or two depending on their age. If they're young, they're going to stay on it longer. If they're a little older and we've made a lot of other changes to their diet and things like that as well, we will just have you stay on that acne med for a solid year of being clear. So once you've been clear and then you stay clear for a whole year, then we can look at maybe taking you off acne med and doing some other things. But yes, the skin can become acclimated to acne med if you're still in that clearing process, and that's why we keep bumping it up. But we rarely have people have to go stronger than a 10%. So yeah, and it sounds like you're staying clear, and that's good. So I think Celine got your question. Hizzle, when do you bump up to 5%? I've been on 2.5 and nothing has helped with cystic chin acne. Okay, so if you've been on 5% for
2.5%.
If you've been on 2.5% in your acne routine for 2 to 4 weeks and you're not getting clear, it's time to bump up to the 5%. But we do some other things in there, Hizzle. So go ahead and follow the link at the beginning of the comments and look at our weeks 1, 2, 3, 4, 5, 6, because you can see that first we go from using Mandelic once a day to twice a day. And then the next thing we do in our next bump is bumping up acne med. So with you, if we were working with you, we would have had you using Mandelic 8 in the morning and then 2.5 Acne Med at night. Then weeks 3 and 4, you would use your Mandelic serum twice a day with Acne Med 2.5. And then with weeks 5 and 6, you would have bumped up to Acne Med 5%. So that's the normal progression, and that's how Face Reality recommends, and that's where we have really great experience. If you're in doubt or having questions, just reach out to our live chat or do an skincare checkup. Okay, the skincare checkups can be found in our reward center. They're for our registered clients. So sign into your account, then go to the reward center, and you'll see where it says skincare checkup. And you can do a checkup that way if you're not in our acne coaching program. If you're in the acne coaching program, just check in with your acne specialist, your Art of Skincare acne specialist, and they will tell you what to do. Sometimes people sign up for coaching and then they don't do any of the follow-up care. They don't check in with us every few weeks. And when you guys do that, our hands are tied. We can't help you progress if you don't check in. So be sure and check in, and we can help you with those bumps. Okay, Hazel, any spot treatment for cystic acne besides sulfur spot treatment because it doesn't work? Well, Hazel, it sounds like you're needing more than just a spot treatment. It sounds like your whole routine needs a little overhaul and some just professional guidance. You might want to sign up for our acne coaching program. It's not expensive. It's $75 for 4 months of acne coaching, and that way we'll get you on the right routine and make sure you're doing the right things to get clear.
Yeah, I'll chime in and say, the reason that we have been trying to do so many more videos with education for Face Reality is because Face Reality products work. They really work for acne, but you have to use them correctly. And when used incorrectly or in the wrong order or the wrong strengths, you're just not going to get that clear skin.
You won't.
You really have to use the system that Face Reality has created, because it's not just the products, it's the whole system and philosophy of how to use them that works so well. And it's why we're singing Face Reality's praise all the time, because they've created this amazing system, but it has to be used
It takes
correctly.
the guesswork out, but you have to use it correctly. And a common mistake that people make too is they don't use the toners. They think, I don't need toner. And I have to tell you that when we first started with Face Reality over 15 years ago, I thought, this is too many steps for teens. I'm going to try not using toner. And I tried doing that. I could not get people clear, and I couldn't keep them clear. So there's a reason we have toners in there. If you're struggling and you're not staying clear, number one is make sure that you're following the correct protocol and that you're using the toner. Don't skip steps. And go in and look at those documents that we've loaded in there and see the different weeks. You can kind of see how it progresses. Now, when you work with an acne coach, they might give you that same protocol for week 1 and 2, or they might change it. They're going to really look at what's unique about your skin, and we often will make little variations and changes. What I put out for you is our most basic way that we start people without doing any kind of customizations. But it works, so got to do the whole system. Christina, thank you so much for all this info. You mentioned RA Pro Salve for around the eye area, but I can't find it on the website. So search Pro Salve with no space. Do that real quick. Ben's going to do it real quick and make sure I have that right. But I think you go to the search and just put in Pro Salve, and just like you spelt it, but no space, and then you'll find it there. Ari says, is it possible to use Acne Med a couple times a week along with...
Oh, fire truck, hold on.
along with over-the-counter retinoids such as Differin? I mean, people do anything. You could do that, but we find that people come to us because Differin didn't work, and we don't have them mix it ever in our acne coaching program. We don't even need to. We get rid of the Differin and we use the Acne Med, and you use it every night consistently. And what we find is that you have to use these correctives, your mandelic acid and your Acne Med, every single day, because your skin needs. I have clients who have told me, oh, I skipped it and the next day I had this big pimple come up, and it's so true. You've got to have consistency. And in fact, we generally start people on that ultra gentle cleanser, and a calming toner or a moisture balance toner for a reason. It's so that your skin can use those strong corrective treatments every day without taking a break. So if we were to put you on a really harsh or strong cleanser and then try and use treatment products, and with it, it would be all too much, and then your skin's going to react to your mandelic acid or your acne med. That could be it for Megan even. If Megan's using too strong of a cleanser and toner, and then she can't use the proper strength serum, skin serum or proper strength acne med, that is a real problem. So I got off on a toot on that. Sorry, you guys. So no, a couple times a week is not great, and mixing your, mixing the retinol. Now, if you're working with a one of our skincare specialists, they might have you using retinol and acne med, but it's only for very few cases, and it's only in very certain situations that we use both of those, and you need to be having some input and guidance. Let us guide you through that process, because if you try and do it on your own, you're not going to be happy. You're going to be frustrated. Megan says, how do you know if you should be using retinol versus benzoyl peroxide? That's why you need an acne specialist. That's why you need Morgan. We can help you with that. If you put retinol on the wrong kind of acne, it will flare up, and you'll just be breakouts upon breakouts, and it's miserable. So you really need to have an acne coach working with you. Morgan, myself, one of our certified acne coaches here at Art of Skincare. They're all licensed estheticians. They look at the pictures, they see who you are, and we have years of experience under our belt. And I tell you right now, we are super cautious about who we put on retinol. So really, you're going to need some professional guidance and help to make that choice. Oh, Ben popped in the ProSav link. Thank you, Ben. Hizzle says, does Face Reality have a retinol? Absolutely.
A retinaldehyde, which is the vitamin A level 1, and then a retinol, which is their vitamin A level 2, which is really strong. I don't recommend jumping straight into that. Even if you've used retinol before, I always recommend starting with the level 1.
Unless you're working with a coach. So if you're working with one of us, we might start you on level 2, but it's because we know exactly where you're at and what your skin is doing. Okay, I think
we missed someone up
Did
above,
I miss someone up here? Okay,
us.
Thank you, Celine.
Ari
says, I'm 33 years old, so just worried about the excess drying that comes with benzoyl. So I get that, Ari. What I have to tell you is that Laura Cooksey, the founder of Face Reality, she and I became good friends over the years. I would bring this up because I have clients just like you would bring that up. Well, I don't want to keep using benzoyl peroxide. I'm afraid it's going to age me. And she would point to her skin and say, I've been using it for 25 years, and her skin looked great. So as long as you're giving it the proper support it needs, you can use it without problem. However, there's no reason to keep using it once we have you clear and you've stayed clear for a year, and we know that we've got your acne control under control, and you're at a certain age. I mean, at the teen years, the early 20s, you might be on acne med for quite a while as you're going through those real hormonal years. But once you're getting into your 30s and later 30s and 40s, once we dial in and figure out what causes your breakouts and we've kept you clear for quite a while, it's very often that we take people off of acne med at that point, and we have a different routine that we put you on, and your acne coach will help you with that, or we can help you with that through our skincare consultation program. Okie dokie. Okay, did we get everybody, Celine?
Yeah, scroll all the way to the bottom. Let's see. Yeah.
We did it. This was a fun time. We only had one disagreement. That's pretty good. And let me say this too, though, that, we disagreed a little bit on the eye thing, and Celine works with her acne clients and in one way, Morgan in another way, myself in another way. There's more than one way to work the program, even though we've just strictly said you've got to follow this protocol, but there's little intricacies within there. And I know that there's certain things that Morgan recommends more than I do. We each kind of have our own flavor of what we do. And there's just more than one way to skin an apple. Is that what they say? That old
Better
saying?
than skin a cat.
Oh, that's what it was. I think it was the skin a cat. Sorry, you guys. So there are some little variations that you can take in there, and we'll sometimes debate things. And sometimes when we get stuck, we'll call on each other and say, "What do you guys think about this?" And we'll come up with an idea that's completely different. You know, if Morgan is stuck, I'll offer a suggestion, or if I'm stuck, Morgan will say, "Well, have you tried this?" And I'll say, "Oh, I hadn't thought of that." And so it's a real team effort that we put into helping all of you guys get clear and stay clear. Okay.
Oh, we got one more question. Okay, Rebecca says, what should I do with the calming toner? It's not as moisturizing as Moisture Balance toner. I don't want to throw it away. Okay, so what calming toner is, it's a rose water toner. That's really what it is. So if you have any empty facial mist bottles, or you get a little spritz bottle, it's amazing as a facial mist over the top of makeup. It can set powder makeup or any kind of makeup, just hydrate the skin throughout the day. That is actually a really great hack for that product, because it's a rose water toner.
It is. So just give yourself nice spritzes. And yeah, you can even order those little continuous spray bottles on Amazon, and you just hold the trigger and it just mists away on your face, and it's really wonderful. So you'll enjoy using it that way. Okay. All right. We did it. We made it. Thank you so much for joining us, everybody. And
any more messages, Squeak?
Celine's looking. One more snuck in. Megan here.
Okay, do you ever find that anyone can't tolerate the Moisture Balance toner with witch hazel? Honestly,
Sure.
I don't have that happen very often.
More often people react to the calming toner.
Yeah.
Go figure.
Oddly enough.
Than the moisturizing one. But if you do react to it, then there's other options. There's always somebody that's allergic to something, right? So we have lots of different options for people.
We have Essence toner from Lemieux. That's really lovely.
Yeah, we have a lot. But as Celine was saying, most often it's calming toner that causes a problem, not Moisture Balance. So if you haven't tried Moisture Balance yet and you're a little nervous, you should feel pretty good, pretty confident trying that, because we very rarely ever have anyone react to Moisture Balancing toner. Okay. Okay, now we really are going to say goodbye to you guys. Have a wonderful rest of the week. Don't forget to get an order in for your Face Reality products today or tomorrow, because prices go up on the 1st. Darn it. I hate price increases.
I know. They've done this pretty much every April for a little while.
Yeah.
Things are just getting more expensive.
It is. All the brands are having to do that to keep doing what they do. And we really appreciate Face Reality. We want them to keep doing what they do, but while you can, get it at the lower price. All right, everybody. Have a wonderful day.